Are those health-boosting natural pills on your shelf secretly working against your kidneys? You know, for many seniors, the quest for vitality leads them to supplements. But here's something to consider. Some of these can unexpectedly cause a spike in creatinine levels, which is a key indicator of kidney health. Now, this isn't just a number on a lab report. It can be a serious warning. Today, we're going to explore 7 commonly used natural pills that might be the culprits. We'll talk about how they can impact your kidneys and what you need to know to protect your health. Number 1, creatine supplements. First up, let's talk about creatine supplements. Creatine is a substance that's naturally found in our muscle cells, and it helps them produce energy, especially during high-intensity exercise or heavy lifting. So, it's no surprise that creatine supplements are popular for enhancing muscle mass, strength, and exercise performance. This might particularly appeal to seniors who are looking to maintain muscle and energy levels as they age. Some older adults might even consider it to combat age-related muscle loss, which we call sarcopenia, or just to improve their overall physical function. Now, when you take creatine supplements, your body converts a portion of it into creatinine. This creatinine is then filtered out by your kidneys and passed in your urine. So, by supplementing with creatine, you're directly increasing the amount of creatine in your system, and that leads to a higher production of creatinine. This can result in an elevated creatinine level in blood tests. And here's the catch. Doctors might misinterpret this as a sign of kidney dysfunction if they aren't aware you're taking the supplement. For seniors, this really poses a particular concern. You see, the natural aging process can lead to a gradual decline in kidney function. If there's already an underlying, maybe even undiagnosed kidney issue, the increased load of creatinine to excrete, or other potential effects of the supplement, could theoretically place additional stress on the kidneys. Dehydration, which can be more common in older adults, can also concentrate creatinine levels, further complicating the picture when creatine supplements are used. So, if you're a senior and you're considering or already taking creatine, it's absolutely crucial to discuss it with your healthcare provider. They need to be aware so they can accurately interpret your kidney function tests. And, of course, ensuring you're adequately hydrated is also very important. While creatine is generally considered safe for healthy individuals, its use in older adults, especially those with pre-existing kidney conditions or those taking multiple medications, really warrants careful medical supervision. Your doctor is the best person to help weigh the potential benefits against any risks. All right, now that we've examined creatine, let's explore another common herbal supplement that might require a second look. Number 2, stinging nettle, Urtica dioica. Moving on to stinging nettle, or Urtica dioica. Stinging nettle is an herbaceous plant that's actually been used for centuries in traditional medicine. Its leaves and roots are said to offer various health benefits, like reducing inflammation, alleviating arthritis pain, treating symptoms of an enlarged prostate, which is benign prostatic hyperplasia or BPH, and acting as a natural diuretic to help flush excess fluids from the body. It's easy to see why seniors might use it for these reasons, perhaps seeking relief from joint discomfort or urinary issues. The primary way stinging nettle might influence creatinine levels is through its diuretic effect. Diuretics, as you may know, increase urine production. This can lead to dehydration if your fluid intake isn't adequately increased. Now, when you become dehydrated, your blood becomes more concentrated, and this can cause a temporary rise in creatinine levels, making it appear as if your kidney function has declined. While this might be a temporary and reversible effect for some, chronic or significant dehydration can indeed strain the kidneys. For seniors, the risks associated with stinging nettle's diuretic properties can be more pronounced. Older adults may already have a diminished sense of thirst, or perhaps mobility issues that make it harder to stay properly hydrated. If they're also taking prescription diuretics for conditions like high blood pressure or heart failure, adding stinging nettle could actually amplify this effect. This could lead to excessive fluid loss, electrolyte imbalances, and an increased risk of kidney strain. Furthermore, while some research suggests stinging nettle might have protective qualities for the kidneys in certain contexts, its use in individuals with established kidney disease should be approached with extreme caution. Any substance that significantly alters fluid balance or kidney workload could be problematic. So, before using stinging nettle, especially if you have any existing kidney concerns or are taking other medications, particularly diuretics or blood pressure drugs, consulting your doctor is absolutely essential. They can help you understand the potential interactions and risks. And if you do choose to use it under guidance, proper hydration is key. Okay, moving on from stinging nettle, let's consider another plant-based remedy often used for urinary health. Number 3, uva ursi, bearberry. This brings us to uva ursi, also known as bearberry. Uva ursi is a low-growing evergreen shrub, and its leaves have a long history of use in herbal medicine, primarily for treating urinary tract infections, or UTIs. Its effectiveness is attributed to a compound called arbutin, which has antiseptic properties. In the body, arbutin is converted to hydroquinone, a substance that can help fight bacteria in the urinary tract. Seniors, who may experience UTIs more frequently, might be drawn to UVA Ursi as a natural alternative to antibiotics. Now, the concern with UVA ursi and kidney health, including its potential to affect creatinine levels, lies predominantly with this hydroquinone it produces. While arbutin itself is generally considered safe in appropriate doses, hydroquinone can actually be toxic to the kidneys if taken in large amounts or for extended periods. This potential for kidney damage, or nephrotoxicity as it's called, means that UVA Ursi is not recommended for long-term use, nor for individuals with pre-existing kidney disease. If kidney damage does occur, this could then lead to an increase in serum creatinine levels, as the kidney's filtering capacity is compromised. Seniors are particularly vulnerable to these risks. Age-related declines in kidney function mean their kidneys may already be less efficient at processing and eliminating substances like hydroquinone. So, if an older adult has undiagnosed kidney impairment, using UVA Ursi could inadvertently worsen their condition. The general recommendation for UVA Ursi is short-term use only, typically no longer than 5 days at a time and not more than a few times per year. It's truly crucial for anyone, especially seniors or those with known kidney issues, to avoid using UVA Ursi without strict medical guidance. If you experience recurrent UTIs, it's really important to see a healthcare provider for proper diagnosis and treatment, rather than relying on long-term self-treatment with herbs like UVA Ursi that carry potential kidney risks. Next up, we'll look at an herb often praised for its immune-boosting properties. Number 4, Astragalus. All right, let's explore Astragalus. Astragalus is an herb that has been a staple in traditional Chinese medicine for thousands of years. It's valued for its purported ability to boost the immune system, increase energy, and act as an adaptogen, which means it helps the body resist various stressors. Seniors might use Astragalus to support their immune health, combat fatigue, or improve their overall vitality. It's often promoted as a general tonic. Now, the relationship between Astragalus and creatinine levels is quite complex and not entirely clear-cut. Some studies even suggest Astragalus may have protective effects on the kidneys, particularly in certain models of kidney disease. However, since our focus today is on supplements that can spike creatinine, it's worth noting that Astragalus does possess diuretic properties. This means it can increase urine output. And as we've discussed with other diuretics, this could potentially lead to dehydration if fluid intake isn't sufficient, which in turn can concentrate the blood and temporarily elevate creatinine readings. Furthermore, because Astragalus can stimulate the immune system, it might not be suitable for individuals with autoimmune diseases such as lupus or rheumatoid arthritis, some of which can affect the kidneys. There's also a theoretical concern that it could interact with immunosuppressant medications. These are commonly prescribed to kidney transplant recipients or patients with certain kidney diseases to prevent organ rejection or manage the underlying condition. Such interactions could indirectly impact kidney health or the interpretation of kidney function tests. So, while direct evidence of Astragalus consistently spiking creatinine in healthy seniors with normal kidney function is limited, the potential for indirect effects or issues in specific populations certainly warrants caution. For seniors, especially those with pre-existing kidney conditions, autoimmune disorders, or those taking immunosuppressive drugs, it's vital to consult a healthcare professional before using Astragalus. Its diuretic effect means paying attention to hydration, and its immune-modulating properties require careful consideration in the context of an individual's overall health status and medication regimen. Let's now turn our attention to an ancient plant known for its high silica content. Number 5. Horsetail, Equisetum arvense. Our fifth supplement to discuss is horsetail, or Equisetum arvense. Horsetail is a fascinating plant that dates back to prehistoric times. It's easily recognized by its hollow, jointed stems that, you guessed it, resemble a horse's tail. It has been used in traditional medicine for various purposes, notably as a diuretic to reduce fluid retention, to support urinary tract health, and for its silica content, which is thought to promote bone, hair, and nail health. Seniors might use it to address edema for its purported bone-strengthening benefits, or perhaps as a general cleansing herb. The primary mechanism by which horsetail could lead to an elevation in creatinine levels is through its potent diuretic action. By increasing urine output, horsetail can contribute to dehydration if fluid intake isn't adequately maintained. As we know, dehydration concentrates the blood, leading to a higher concentration of waste products like creatinine. This can give a false impression of declining kidney function or, in severe cases, genuinely strain the kidneys. Another concern with some horsetail species is the presence of an enzyme called thiaminase. This enzyme breaks down thiamine, which is vitamin B1, and prolonged use of horsetail containing thiaminase could lead to thiamine deficiency. This can have serious neurological and cardiovascular consequences. While many commercial horsetail supplements are processed to be thiaminase-free, it's an important factor to be aware of. Additionally, some species of Equisetum contain traces of nicotine, which could be problematic for certain individuals. There have also been reports of horsetail causing kidney irritation in some cases, particularly with high doses or extended use. For seniors, the risks associated with horsetail's diuretic effect are heightened due to potential pre-existing kidney issues or a reduced ability to manage fluid balance. If an older adult is already taking prescription diuretics, adding horsetail could lead to excessive fluid loss and electrolyte disturbances. It's certainly advisable to ensure any horsetail product is thiaminase-free and to use it only for short periods, with careful attention to hydration. Consulting a doctor before using horsetail is particularly important for seniors with any kidney problems or those on other medications. Continuing our exploration, we will now discuss a familiar flavoring agent that also has a history as an herbal remedy. Number 6. Licorice root, Glycyrrhiza glabra. Next on our list is number 6, licorice root, or Glycyrrhiza glabra. Licorice root is, of course, well known as a flavoring agent in candies and beverages. But it also has a long history of medicinal use for conditions such as digestive problems like stomach ulcers and heartburn, sore throats, coughs, and as a support for adrenal gland function. Some seniors might use it for these soothing effects or for its perceived benefits on energy and stress. The component in licorice root responsible for many of its effects, both therapeutic and adverse, is glycyrrhizin, or glycyrrhizic acid. When consumed in significant amounts or for prolonged periods, glycyrrhizin can cause a condition known as pseudoaldosteronism. This syndrome mimics the effects of excess aldosterone, a hormone that regulates salt and water balance. It leads to sodium and water retention, potassium loss, and consequently can cause high blood pressure, low potassium levels, which is hypokalemia, and edema, or swelling. These effects can put considerable strain on the cardiovascular system and the kidneys. Elevated blood pressure and fluid retention can impair kidney function over time, potentially leading to increased creatinine levels as the kidneys struggle to cope with the added stress and altered hemodynamics. Seniors are often more susceptible to the adverse effects of glycyrrhizin. Many older adults already have conditions like hypertension, heart disease, or existing kidney impairment, all of which can be made worse by the effects of licorice root. The risk of developing hypokalemia is also a significant concern, as low potassium can cause muscle weakness, fatigue, and even dangerous heart rhythm disturbances. Furthermore, licorice root can interact with a wide array of medications. This includes diuretics, which can lead to excessive potassium loss, blood pressure medications, where it can counteract their effects, corticosteroids, and blood thinners like warfarin. For these reasons, regular consumption of licorice root containing glycyrrhizin is generally not recommended, especially for seniors or individuals with the health conditions we just mentioned. If licorice is used, it really should be in very small amounts and for very short durations. A safer alternative for flavoring or some of its soothing properties is deglycyrrhizinated licorice, or DGL. In DGL, most of the glycyrrhizin has been removed, significantly reducing these risks. However, even with DGL, discussing its use with a healthcare provider is always a wise move. Our final supplement in this list is derived from a coniferous tree and is known for its distinctive berries. Number 7, juniper berries. And that brings us to juniper berries. Juniper berries, which are actually the female seed cones of juniper trees, are most famously used to flavor gin. They also have a history in traditional medicine as a diuretic, for treating urinary tract infections, and for alleviating digestive issues like bloating and indigestion. Some seniors might encounter juniper in herbal tea blends or use it specifically for its diuretic or urinary antiseptic properties. Juniper berries can impact kidney health and potentially creatinine levels, primarily due to their strong diuretic effect and their potential to act as a kidney irritant. The volatile oils in juniper, such as terpenine 4-ol, are thought to be responsible for increasing urine flow by directly stimulating the kidneys. While this can be helpful for flushing the urinary system in some situations, it can also lead to dehydration if fluid intake isn't sufficient, thereby concentrating creatinine in the blood, as we've seen with other diuretics. More significantly, juniper is considered a direct kidney stimulant. In some individuals, or with high doses or prolonged use, this stimulation can cross the line into irritation or even damage to kidney tissue. This nephrotoxic potential means that juniper berries are generally not recommended for individuals with any form of kidney disease or inflammation, as they could worsen the condition. If kidney damage occurs, the kidney's ability to filter waste products like creatinine is reduced, leading to an increase in blood creatinine levels. For seniors, whose kidney function may already be compromised due to age or underlying health conditions, the use of juniper berries poses a notable risk. Even a mild irritant effect could be problematic for kidneys that are not functioning at full capacity. Therefore, Juniper berries should definitely be avoided by older adults with known kidney problems. For those with healthy kidneys, any use should be very short-term and with caution, always ensuring adequate hydration. It's always best for seniors to consult their healthcare provider before using juniper for medicinal purposes. Now, while these 7 are primary concerns, it's important to know that other natural products also warrant a careful approach. Other supplements to approach with caution. Beyond the 7 supplements we've just detailed, several other natural pills and herbs might pose risks for seniors, particularly those with kidney concerns. These could potentially influence creatinine levels or overall kidney health, so it's wise to be cautious. For example, cat's claw, an herb from the Amazon rainforest, is often used for its supposed immune-modulating and anti-inflammatory properties. However, there have been some reports linking it to kidney problems in certain individuals, and its effects on those with pre-existing kidney conditions aren't well understood. Goldenrod is another herb traditionally used as a diuretic and for urinary tract health. Like other diuretics we've discussed, it can increase the risk of dehydration if fluid intake isn't carefully managed, which could temporarily affect creatinine readings. So, seniors using goldenrod should ensure they drink plenty of fluids. Parsley root is also known for its strong diuretic effects. While parsley leaf is a common culinary ingredient, parsley root in concentrated forms or supplements can significantly increase urine output. This might be problematic for individuals with kidney inflammation or impaired kidney function. The general message here is that even products labeled natural can have powerful effects on the body. For seniors, whose bodies may be more sensitive and who are more likely to have underlying health issues or be taking multiple medications, extra caution is always warranted. Why seniors are at higher risk? So, why are seniors often more vulnerable to the adverse effects of supplements that can impact kidney function, including those that might raise creatinine levels? There are several key reasons. Firstly, kidney function naturally tends to decline with age. This means that an older person's kidneys may already be working with reduced capacity, making them less able to handle additional stress from certain substances or medications. Secondly, something called polypharmacy, which is the use of multiple medications, is quite common among seniors. This increases the likelihood of drug-supplement interactions, and some of these can be harmful to the kidneys or alter how substances are processed and excreted, potentially affecting creatinine levels. And finally, older adults have a higher prevalence of underlying conditions such as diabetes and high blood pressure. Both of these are major risk factors for chronic kidney disease. So, taking a supplement that further strains the kidneys can be particularly risky in this context. Signs of elevated creatinine and when to seek help. Now, elevated creatinine itself often doesn't cause direct symptoms until kidney function is significantly impaired. However, there are signs of underlying kidney problems that might lead to high creatinine. These can include persistent fatigue or weakness, and swelling known as edema in the legs, ankles, or feet. Other symptoms might involve changes in urination, such as urinating more or less frequently, perhaps noticing foamy urine, or even blood in the urine. Nausea, vomiting, loss of appetite, and itching can also occur as kidney function declines. Regular kidney function monitoring through blood tests, which measure creatinine and calculate something called the estimated glomerular filtration rate, or eGFR, and urine tests is crucial. This is especially true for seniors, those with risk factors for kidney disease, or anyone taking supplements regularly. If you notice any of these symptoms or are concerned about your kidney health, it's really important to seek medical attention promptly. Safer approaches to health support in seniors. Supporting health and wellness in the senior years doesn't have to involve risking kidney function. Thankfully, There are many safer, evidence-based strategies. A balanced, kidney-friendly diet that's rich in fruits, vegetables, and lean proteins, while being mindful of sodium, potassium, and phosphorus intake if advised by a doctor, is absolutely fundamental. And staying adequately hydrated by drinking enough water throughout the day also supports kidney health. Regular, appropriate physical activity helps maintain overall health, including cardiovascular function, which, as you might imagine, is closely linked to kidney health. When it comes to supplements, the safest approach is always to discuss any and all potential supplements with a healthcare provider. They can help determine if a supplement is truly needed, if it's safe given your individual health status and medications, and can recommend specific doctor-approved options if necessary. So, to wrap things up, while the allure of natural remedies is certainly strong, it's clear that natural does not always mean safe, especially when we're talking about kidney health in seniors. Understanding which supplements have the potential to raise creatinine levels allows older adults and their caregivers to make more informed and safer health choices. The key takeaway is to always consult with a healthcare provider before starting any new pill or supplement, whether it's labeled natural or not, particularly if you have existing kidney problems or are at risk for developing them. If you found this information helpful, please consider sharing it with friends, family, and any seniors in your life to help protect their kidney health. For more science-backed wellness guides, do subscribe to our updates. We also invite you to leave a comment below sharing your experiences with supplements and kidney health. Your insights can greatly help others navigate these important decisions.